Welcome back to another episode of The Hard Truth. And as always, the hard truth is that hard truth that the daggone successful embrace and the weak run from. And listen, one of the things we want to do is continue to not only provide you with, the hard truths, the hard truths, we want to provide you with some scientific truths, some factual truths, and to put things out there and make you aware of all of the ways that you can approach your health and wellness. And with that in mind, I was like, I've got to have my main man on here, Eric Rittmeyer. Listen, this dude is an absolute savage. Not only is he a good-looking guy, he's got muscles, whole 9 yards, with beautiful smile, right? But the business development leader over at LifeMed Institute, an organization that I use, I'll tell you right now publicly, the best customer service of any organization I've ever worked with. Just absolutely from top to bottom, a phenomenal organization. Author, mental toughness, menopause. You never say former Marine with them because that always offends them. They're always a Marine. Marine Corps veteran Eric, so pumped to have you on the show and give you an opportunity to share with the listeners all of the things that you have a depth of knowledge in. Did I miss anything?
Oh no, Dave, that was dude. I've done a ton of television. I've done a ton of speaking. I've never heard an intro like that, bro. That was pretty awesome. I think you covered every angle, man. Thank you for all the
Good,
kind
good.
words and everything. I appreciate it, brother.
Yeah, 100%. So, the first question that we want to dive into is like, listen, Marines are often joked about being crown eaters and the whole 9 yards, but obviously you're an exceptional Marine. Like you have the ability to write. You wrote multiple books. How did you find yourself in the line of work that you are with LifeMed?
Yeah, it's wild, man. It started with my whole mental toughness and emotional intelligence stuff. I published my first book back in 2019 called The Emotional Marine. It's systematic desensitization, graduated exposure therapy, critical thinking, it's self-awareness, self-regulation. It's how to instantly connect with people. And I just was infatuated with the topic. I still am. I love human behavior. I love connecting with people. I love psychology. All that stuff's wonderful. And then about 3 years ago, I was approached about helping to build out this business, LifeMed, and we wanted to grow. There was an opportunity there. We saw an opportunity. So I took my platform skills of being able to get on stage and convey a message. I took my television skills that I use when I go on TV. I've done probably 1,000 shows since launching my book. It was just a perfect fit. I had to learn a whole new language. I didn't know anything about medical. I didn't know what a red blood cell was a few years ago. So I had to learn all this stuff. But my infatuation kind of morphed into the medical field, and I've just become obsessed with all things health, women, men. I especially love helping women with all the menopause stuff, but guys, girls, it's an awesome, awesome topic. I'm happy to be here with this stuff. I love talking about it. I love discussing it. I love the path that led me here.
Now, you look at this and it's actually I like to talk about the ways that people find success because oftentimes the person that is the founder or the CEO or the president, they're the one that ends up being the face. But like you were brought in to be the face of the company. You do a phenomenal job at it. It's such a weird scenario though from what people traditionally think about. What did you say? What did you do? What made you become the face of an organization? Because that's just unheard of.
Yeah, I think it's kind of weird, Dan. What led I've had a lot happen. I was married for 19 years. My wife had a ruptured brain aneurysm back in 2013. It's just my whole life kind of went a little crazy. I envisioned myself speaking forever. I was in the mortgage business for a long time as well, doing reverse mortgages. I mean, it's kind of a little bit of everything. So when I came into this, I think what it kind of morphed into was just again my on air the shows I'd done. It was just kind of like it was a good fit. So I already had the experience of being on camera, being on podcasts, being on radio. It was a good fit. And then once I learned the lingo, it was like, hey, before I knew it, I was doing this event, that event, this event. Now I'm up to doing, probably close to 400 events a year. And that's the ones that are live. And then I have all the other stuff. So it just, every timing worked out perfectly. I was in the right place at the right time. I was in the right place in my life. I was in that rebuilding phase. So for me personally, I just took this obsession and transferred it over into something that would get us more business, which worked well.
For all the small business owners or the entrepreneurs that are out there, when you say business development, when you give that as a title in your mind, what does that mean? Because it's not a title you hear often.
Yeah, it's just generating business, right? For me, it's all about I live and breathe. And I think if you look at anyone in any line of work, and really irrespective of ownership or leadership or whatever it is, you want people to feel like they have ownership in whatever company it is they're working for. As the owner, that's easy to do, but everyone else whose name is not on the LLC, it's difficult to do. And I think once you develop that feeling, like with being prior military, it's like I've been out of the Marine Corps for a long time. I just turned 50. You can take the Marine out of the Corps. You can't take the Corps out of the Marine. Same thing with any other branch, right? We live it and breathe it. And I think once you have people that really subscribe to that and really start to wear that logo, whatever logo it is, when they wear that logo with pride and when they represent that brand, that's what you want. So for me, that's where I was with. And I think anybody, any line of work, once you're passionate about what you're doing, and it sounds cheesy to say, it's one of those things like, oh, when you love what you do, you're never really working. And I never really fully appreciated that. Now I do because I found it. So I think in any line of work, once you just become so obsessed with something and you believe in it, if you're willing to put in the work, it's lights out.
And one of the things I want to highlight, and I try to have this conversation with people across the board, is like, you just said you're turning 50. You don't fucking look 50. Not even a little bit, right? Like, I don't think anybody on the show would go, Eric's 50, right? They see you. So physically you don't look 50. And then from an energy level, I mean, you're fucking go, 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 go. Let's talk about that. Why do you think that you have remained youthful looking, and not just youthful looking, but clearly youthful feeling? I mean, you can't fake that type of energy level if either you have it or you don't have it. And what do you credit it to?
Yeah, that's a good question, Dan. For me personally too, I think it goes back to my mental toughness training. Again, this is all stuff that I'm preaching to the choir with you and anyone who's in the military. But when there's an objective, when there's a mission, you improvise, you adapt, and you overcome. So for me personally, I feel like one thing I've gotten pretty good at, and my suggestion to anyone that I work with, that I speak to, that I train, my suggestion to them is find something that you enjoy, obviously, but get very good at just dealing with the issues, right? Just find a way to find something fun about what you do. So for me, regardless of what it is, I'm just always trying to find a way to say, okay, this is what I love doing. This is awesome. This is great. And it's just maintaining it. And again, it all goes back to the obsession and just the willingness and really, really believing 100% what you do. It can't be half-hearted. And for me, I got to be all in on anything. I'm the absolute worst salesperson when it comes to pitching a product I don't believe in. I refuse to
Yeah.
do it. If I don't believe in something I'm doing, I'm not going to stand up and do it. So for me, I think it's about the emotional control piece too, with my mental toughness, remaining control of emotion, focus the energy, and just try to minimize, anything anytime anything negative enters the stratosphere, I try to shut that down real quick.
So let's do a delve in. Let's start with men, right? Let's do a delve into HRT for people that don't know what it is. People that I think I would say at the end of the day, what I'd love to be able to separate in your mind. I don't think I've ever asked you this before. Actually, is HRT steroids?
Yeah, so this is what's funny when you hear this, right? So you hear HRT, TRT, hormone replacement therapies, bioidentical. It's not the actual administration of the medication. In my mind, it's not the administration of the medication that determines whether it's steroids or if it's hormones. It's the amount that you're using. So if you talk to someone who's on HRT, hormone replacement therapies, so for guys normally gets coined as TRT, testosterone replacement therapies. This is a medication. This is a testosterone that we administer to men once they've gone through the process of all the blood panels. We do extremely extensive blood panels. Anyone considering testosterone replacement therapy, I would very strongly encourage them to only deal with companies that require full blood panels and a very extensive meeting with the medical professional to make certain that you are healthy enough to start the medication. Assuming you are, the emphasis is on the word replacement. So when we're working with men specifically, what we're looking to do is to replenish their testosterone levels to physiologic levels. So if your level is here and now your level's here, we look to restore that. As men, as we age, testosterone gradually decreases. We lose a couple percent every year once we hit about the age of 30. There are things that can accelerate that decrease in testosterone. The number one thing being BMI, body mass index. The equation they use is for every 5% increase in BMI. It actually accelerates your testosterone age by 10 years. So as it relates to taking testosterone to restore to physiologic levels, it's under the care of a medical professional. You're being prescribed this by a doctor. It's bioidentical. It matches almost molecule for molecule what your body makes on its own. But very important to point out, Danny, testosterone replacement therapies is not for everyone. This gets mismarketed across the board. Hey, if you're a guy and you feel lethargic, you're lacking some energy, maybe some sex drive issues, give us a call. It's like, who doesn't? What guy doesn't? I mean, any guy can fit into that. Then the other issue becomes obviously age. Is, if you're too young, it's probably not wise. Long answer to your question, I would say the number one thing would be steroids compared to testosterone replacement therapy is it's prescribed by a doctor. We're restoring to physiologic levels, and you know exactly the medication you're getting it. You're not buying in an alleyway somewhere and taking excessive amounts that could have extreme damage to you.
I think one of the things that separates you guys, and maybe you do have a guy that has a past with it that is, that's a spokesperson for you. If you do, I don't think there's nothing wrong with it. But when I look at a lot of these other testosterone replacement companies out there, they tend to have former bodybuilders as their main advocates. And I think a lot of times that's where the correlation becomes, there's a guy who I love, and I don't think there's anything wrong with what he says, this Donald Cowboy Cerrone. And I think one of the things that he said, and I love the guy, right? He's like, I am a Donald fan. But I think one of the messages that they have out there is, once I got out, I told you I was getting on the good shit. And so then that makes everybody think that, okay, this is steroids. And then if you have an aversion to that, like what I tell people is at the end of the day, like, I don't personally give a shit who takes steroids. I could care less. It doesn't bother me at all. My recommendation to everybody is I'll recommend a lot of people to you. I've sent a lot of people to you. What I don't recommend is going and buying something from your gym bro in the back of the gym. You have no clue what that is. Like, you literally don't even know what that is. That shit could be water as far as you're concerned, or it could be horse tranquilizer, right?
Yeah.
But they have this conception that I'm going to get on this. This is steroids. America, I think, has done a very, very piss poor job of the way they attack steroids. And the truth of the matter is, a lot of the people that everyone knew that was on steroids, they're still alive and kicking and doing well. You look at the Lou Ferrignos, the Arnold Schwarzeneggers. But then we have the flip side of it. I'll call it the WWE story, right? Which they blamed wrestlers' deaths on steroids. They blamed Chris Benoit on steroids and all this roid rage. But the truth is actually far less insidious, right? Like, most people, their mood gets better if they're on TRT. Am I right?
Absolutely. Another important thing too, Dan, it's funny, like even with our patient base here, I mean, the vast majority of our patients, you would never know that they're on testosterone replacement therapies. Their objective is not to go to the gym to set new PRs, right? Their goal is someone like me, again, who just turned 50. I'm looking to restore my levels. I'm looking for the additional energy. I'm looking for some of the lean muscle mass that you will get if you combine exercise in conjunction with it. If you diet, if you exercise, testosterone replacement therapy is not something that you do in lieu of all those other things. It's in conjunction with it. And again, if you look at some of the studies too, they show the long-term cardiovascular benefits of testosterone. I just think it all boils down to, there's so much emphasis that needs to be put on, number one, are you a candidate for it based on your blood? And then number two, once a guy starts on this, it normally is for the long term. So there are some other medications that can be prescribed if you have guys that come in under the age of 35 or 40-ish. There are some other medications that they can take in lieu of regular testosterone, because unfortunately, once you do start taking it, it's something you stay on for the long term. Number two, it does suppress your body's natural production of hormones, follicle stimulating hormone, luteinizing hormone. These are things that trigger the testes to produce testosterone and sperm count. So if you have a young guy who starts too young, their body's natural production can lay dormant. When they decide they want to come off of it to maybe start to have kids, they could find some difficulty in doing that. So this is something that has to be viewed through the lens of a medical provider is going to be prescribing it, that the blood has to be thoroughly reviewed, because again, this is not something that should be taken lightly. It gets marketed as if you're taking like an over-the-counter vitamin C supplement. This is a long-term commitment, and it's not something that should be taken lightly by anyone.
So the long-term commitment is actually a concern that a lot of people have. My concern, and the conspiracy theory in me, my concern with the long-term commitment was like, oh shit, the supply chain goes down and now I'm not able to get it anymore. Like, what do you think the reality of that concern is? And if case, worst case scenario, something like that were to happen, what would be the approach one would take to navigate it?
Yeah, that's something we do here sometimes, and I mean, I think everybody kind of runs to their brain. The conspiracy theorist might say, hey, everybody gets on testosterone. Their body's now reliant upon it. Let's shut down the source. Now you have a whole generation of males who are incapable of producing the most dominant androgen in their body,
Yeah.
right? So I think that's a fair concern. The thought process there, Danny, the way I view it is kind of like, okay, if we just continue to, as guys, I feel like it's not as extreme as women. We'll probably talk about women a little bit too. But, for guys, I feel like the decline in testosterone is very gradual to the point where the majority of us, we don't really know how bad we feel until we start feeling good.
100%.
That's what I always say for our patients. Like the dosing that we start our patients on, they're normally going to start to feel pretty good, but it's not like this Superman feeling. It's just a major misconception. So as far as there being a fear of long-term supply chain issues, I think that's valid. But it doesn't mean that when a guy comes off of exogenous testosterone, it doesn't mean their body's going to be incapable of producing it. We don't know where it goes to. That's definitely something that has to be considered.
So we talked about, I think this is actually a good transition into the female side of the house because a lot of people don't talk about that. But how does testosterone, you mentioned cardiovascular health, how does testosterone affect men's health? And then would you go into some elaboration about what you've taught me about how important testosterone is for females?
Yeah, I mean, so obviously for guys, it's, again, you get into the muscle mass, you get into the loss of body fat, you get into the energy, the sexual vitality. Again, the cardiovascular piece, I think, it's probably the most important piece of it. The restoring it, again, emphasis on physiologic levels, restoring it back to where it was at one time, not putting you outside of what your body never produced on its own. That's for the guy side. For the women's side, a lot of women are surprised to hear, Danny, actually a woman's dominant hormone is testosterone. A woman makes more testosterone than estrogen, which lots of ladies are very surprised to hear. They think of testosterone for men, estrogen for women, which is true, but both men and women make both of those hormones. For a woman, testosterone's dominant. Now, when you compare the production of testosterone for a woman compared to a man, it's still a fraction, about 1/20th of what a guy makes. But testosterone is critically important for women as well. So it's all these things as far as educating that's so ridiculously important. Again, from my standpoint, not being a medical person, someone who's not able to prescribe, someone who's not able to give medical advice. And I think this would be my disclaimer to say, please don't take anything I'm saying here today as any sort of medical advice. But it's so important, men, women, young, old. We have to educate ourselves on all things. So when we go to the doctor, we're not allowing them to make 100% of our medical decisions for us. We're doing it in conjunction with them. Very important, I think.
I think it is an important thing, but one of the things, and I don't know if this is something you're comfortable speaking on, but one of the big problems that I see when I first start talking to people about the opportunities and the options for HRT is that when they do go to their doctor, right, if you do go to a quote unquote traditional, uh, you know, primary care physician, if your testosterone level can be between 200 to 1,000, and you're 245, they're like, okay, well, you're normal, right? And so this is kind of like the weird catch 22 about this scenario. And really, medically speaking, all across the board, I mean, people will always say get multiple opinions, but you can go to three different doctors and get three different recommendations for it. So how does somebody, and this is the health field as a whole, like this is this is personal training, this is nutritionist, you can go watch a documentary that says eating red meat is horrible and then turn around and watch it, eat only red meat, it's the best. And they'll both have facts, they'll both have stats. And I think this is why the consumer is so fucking confused. They have no clue what to go because everybody's saying something different. What advice would you have around, well, how do I even pick which doctor to talk to?
Yeah, again, this goes back to any number one self-education. We live in a day and age right now where, I refer to this as an inch deep and a mile wide. We should be just a little bit informed. We go an inch below the surface on lots of different topics because, again, we have to make certain that we're viewing everything through our lens. Every person, medical person, non-medical person, everyone kind of puts their own little spin on things based on prior life experiences, biases they may have. As it relates to testosterone specifically, you referenced that range. It's measured in what's cut nanograms per deciliter, and it goes from 250 to 1100. Where I think the biggest problem is they take someone like me who's 50 and they say, okay, you're at 300. You look good for your age. That's normal for your range. And I think that gets viewed as, oh, well, that's where it should be. My thought process is young, old, whatever you want to call it. If you have a testosterone level, why would you not want to optimize that? So if you're at 500, even though it's normal for your age, why would you not want that to be more towards the upper end? Why would you not want to optimize that? Now, again, very important to point out, there are underlying health conditions that we have to be cautious to make absolute sure someone's healthy for that. But to make the blanket statement, why would we just want to keep these very low levels that, yes, are still in range? Why would we not want to optimize that so we can feel better, so we can thrive instead of survive, so we can enjoy running around with our kids, being active, building lean muscle mass, anything with longevity related? Every single person who specializes in anything relating to longevity will emphasize the significance in retaining lean muscle mass. Sarcopenia, right? As we age, we lose lean muscle mass. If we can retain that lean muscle mass, there's study after study that shows the benefits of that. Glucose disposal, your decreased risk for type 2 diabetes, your decreased risk for cardiovascular disease, neurodegenerative disease. There's all these benefits to it. So when you take all that into account, if we educate ourselves, going armed with our providers, making decisions in combination with them, and we just go with who we're comfortable with. But I think in the medical community, there needs to be a lot more education put into therapies that are available, studies that are done, and the benefits to doing these things, instead of just making a blanket statement saying, no, you shouldn't. I think that can be dangerous.
And, one of the things that I think people run into with, right, and one of the reasons they don't come to organizations like you is they're like, well, insurance doesn't cover it, right? Here's the crazy thing about it. And I'm sure everybody's a little bit different. But hormone replacement therapy, honestly, truthfully, if we reduce this shit to the ridiculous, it's not that expensive. It's not that expensive at all. And on top of this, right, like my TRT for 3 months is essentially maybe a little bit more. But if I broke it down into the monthly expense, I can't go to fucking GNC and get it. And I'm getting the little snake oil with the asterisk mark that doesn't do shit. This is like the legit thing, doctor prescribed in there. And so the reality is it's not as cost prohibitive as I think people believe that it is. But on the flip side of all of this is, what is the price for feeling good? You know what I'm saying? Like, what are you willing to invest in to stop feeling like shit? And then even for you guys, for example, I assume most or other organizations, one thing I've always respected about you, you've always been like, listen, we're not the only people that do this. You could go elsewhere, yada, yada, yada. But you guys actually help out where really if they're going to pull the blood work, a lot of times their insurance covers it, or you guys go through, who is it you go through that actually can cover most of it up to like $50?
Yeah, we run through Quest primarily.
Quest.
Yep, we run through Quest primarily. And you brought up another really good point there too, Dan. With our blood panels, and you just said it here, obviously we're not the only facility that operates this way, but with us, we pull a very extensive blood panel. This is advanced biochemical testing. So for our male patients who come out thinking that it's testosterone that they really want, that blood panel is going to uncover lots of things. And the cool thing about our panels, they're extremely extensive. It's hormones, genetics, cardiac particle sizes, metabolic, kidney, liver function, glucose levels, thyroid levels, inflammation markers, vitamins. You get that hour with the provider to review all that. I'm obsessed with hormones, with testosterone, with estrogen, with progesterone. I'm probably almost equally as obsessed with cardiovascular health. I mean, look at cardiovascular disease, number one leading cause of death, hands down. We have more information. We have more data. There are more studies. There are more pharmacological interventions for cardiovascular disease than really any other disease. And it's really one of the only inevitable diseases of our species. Almost every one of us will die with some form of cardiovascular, ASCVD, atherosclerotic cardiovascular disease. So we have all this information on the topic. We have all these pharmacological interventions, yet it still remains the number one leading cause of death. It just baffles my brain. So it's all about knowing what's happening internally. The great thing with our panels, like any full panels you normally get, the good thing is anything we find in there, any type of abnormalities that we might detect, almost all of them can be corrected either with modifiable lifestyle issues, corrections to exercise, or sometimes pharmacological interventions.
And one of the things to point out is, one of the things that you guys noticed was my B12. and I got a B12 vitamin. I mean, that shit was like $20, and it is a noticeable change, right? And this is the thing that's kind of great. I think the future of fitness is going to somehow, some way merge where, the very beginning when you come in, one of the first things that we're going to tell you to do is go get a blood panel. Let's look at the results of that blood panel and then base a program off of that and give you proper supplementation. Because some people just take supplements blatantly. You might have no use for what you're taking. You might be oversaturated. Your body might not be able to absorb the shit that you just bought. Or meanwhile, if we just upped your vitamin B12 or we gave you vitamin D because you were deficient, you're going to see a fundamental different change in there. Because the truth is, you can go to the gym, bust your ass, work hard. If your hormone levels are shit, if you're not getting nutrients, minerals, all of those things are thrown off, you're not going to be successful. And this is why I encourage anybody to go get a blood panel. And it doesn't take that much time. I mean, we were up there. I think the blood panel took, a whopping 10 minutes, and then I got an IV in a cool ass lit up room, and you were able to go out there. So for people that don't understand how this process works, let's say I was a man or a woman, or I was interested in considering going down the path, wanted to educate myself, wanted to find a good starting point in the HRT, TRT world. What steps would you recommend they took to get started?
Yeah, I would recommend finding an expert in this, Danny. You want to look for a credible medical facility. I categorize us as one of them. Obviously, our medical director is a cardiologist. We have 10 nurse practitioners, 2 physician assistants, 1 additional MD that works underneath our medical director. They're spread out amongst our 5 locations. So I would recommend finding a medical facility that does specialize in hormone replacement therapies. And then the blood panels, coming out, talking with someone, educating yourself, doing your own research, but also talking with someone. Obviously, as always, your viewers are more than welcome to reach out to me. My cell phone is on 24/7, but it's about just getting the baseline education. And then assuming that someone's ready to move forward, we get blood panels. Us personally, we have Quest in-house. So you're able Monday through Friday to get a blood panel. We do want a fasting blood panel. So 8 hours, no food, black coffee, water's okay. You don't have to come in-house. You can also go off-site. And then it's the findings of the blood, I think, that's so important. It really differentiates facilities apart from each other. It's not just going to the blood, detecting what's red and addressing the things that are very clearly broken. We most certainly do want to address those, but we're looking at what's yellow. We're looking at what's green on that panel as well, because again,
Yeah.
this is about optimization. And you reference B12. B12 is a required nutrient. It's one of the only nutrients that we must have as humans that we do not make on our own. We rely on animal meats for it: chicken, beef, fish. We use what's called methylated B12. These are subcutaneous injections. It can also be incorporated as part of your intramuscular testosterone injection if you're a candidate for testosterone. But something that simple could just be that one little, all of a sudden you feel like $1,000,000 because of something as simple as B12. So it's one of those things where you don't know what you don't know. Finding experts in the field can guide you through that. And again, not just looking at the testosterone, looking at all the cardiac markers as well, because cardiovascular disease is very real and very preventable.
And how about women with menopause, perimenopause, most menopause? How is that showing up, and what are you guys able to help them with?
Yeah, so we did a webinar together, Danny, a few months ago, 2 months ago, whatever, which was awesome. And I can't thank you enough for having me on. I love doing those types of events. I just published my second book, The Menopausal Marine, a couple months ago. And this is on hormone replacement therapies. I'm obsessed with women's health, specifically hormone imbalances, and menopause would be a gross understatement. I cannot read enough. I cannot study enough. Women, I believe, as guys, we can survive with low testosterone, right? Some extra body fat loss and muscle mass. When ladies come out here, I mean, a lot of times they're struggling. It's hot flashes, night sweats, brain fog, insomnia, hair thinning, weight gain, sexual vitality, vaginal atrophy, vaginal dryness, urinary tract infections, heart palpitations. A lot of them have gone to their GYNs. They have had their blood draw done. They've been told that they're in range. And the advice when they leave their doctor's appointment is don't eat chocolate chip cookies, don't drink wine, take anxiety medication. So when they get in front of me, they're normally pretty emotionally distraught. Their husbands think they're cheating on them. There's no sex drive. It actually physically hurts to have sex. They're not sleeping right. They have this brain fog. So for me personally, with the women's health stuff, I've become infatuated with it because I do believe the improvement, the quality of life for females, I feel like is so much more significant on hormones. It helps with guys as well. Guys feel great afterwards, but I feel like as guys, we can kind of get by with low testosterone. We shouldn't have to, and it's not the best thing ever. But for women, the loss in ovarian function is normally very extreme, and it's almost an overnight thrust into this all these different types of symptoms. So women's health is what I'm just obsessed with.
And I'd like you, as we get close to the end of this, one of the things I want us to touch base on, because this was eye-opening to me, is what is the cardiovascular ramifications for females that are coming, that are entering that post-menopause phase?
Yeah, another great question, Dave. So here's the thing, right? As a woman, ladies have about a 10-year protection over men for heart health. So if you have a 40-year-old woman, she has the heart of a 30-year-old male. If you have a 50-year-old woman, she has the heart of a 40-year-old male. That woman has that heart protection up until the age of about 65. At 65, all of a sudden, women now become more susceptible to what's called ASCVD, atherosclerotic cardiovascular disease. Women now become more susceptible to that than men. So the thought process is, women have this endogenous estrogen that they have every single month from the date of their first period to the date of their last period. Their ovaries are firing off estrogen and progesterone pretty consistently. That estrogen is providing the heart protection. When a woman goes through menopause, average age 51 years old, she now has up to 14 years of no estrogen protection. Now that woman becomes more susceptible to cardiovascular disease, not to mention osteopenia, osteoporosis, bone density. These are real. You want to talk about a horrifying disease. You don't want to see the stats on hip fracture surgeries over the age of 60. Neurodegenerative disease, Alzheimer's, 2/3 of Alzheimer's patients are women. Like, does anybody ask these questions as to why a woman's more susceptible to these neurodegenerative diseases? Could it be because of the abrupt loss of estrogen? So the whole point behind hormone replacement therapies for women is really twofold. Number one, almost immediate menopausal symptom relief if they're exhibiting the symptoms, gives them back that quality of life. Number two, equally if not more important, are the long-term benefits: bone, brain, most importantly, heart health. As a woman, they are 8 to 10 times more likely to die of cardiovascular disease than they are breast cancer. Breast cancer is
No
disgusting.
one
Breast
talks
cancer is
about that.
horrible. Breast cancer makes me want to gouge my eyeballs out. But let's be realistic. A woman is much more likely to die from the heart than they are from breast cancer. So there needs to be a lot more emphasis put on protecting women's hearts.
So one thing, and I don't know if this is something you can speak to, but a woman is postmenopausal. She goes on HRT. Maybe this is a dumb question. Maybe I should know the answer to this. But what does that really mean for her? Because prior to this, this is all going on a cycle, right? So we're going through the whole egg production, the whole 9 yards, but that's gone now. So when they're on the hormone, when they start HRT, is it still following any form of a cycle, or are they more leveled off? What do we see with that?
Yeah, so it depends on when we initiate it, Danny. The key is, I mean, pretty much any of the major medical organizations all kind of follow the same philosophies. The American College of Obstetricians and Gynecologists, the American Association of Clinical Endocrinology, the Endocrine Society, the North American Menopause Society, they all kind of follow the same rule, if you want to call it that, which is 60 years old or younger, less than 10 years postmenopausal. That's where they kind of view it as being the safest for women to start hormone replacement therapies. So the key is, depending on when a woman starts, the hormone imbalances, if they're just getting it through menopause, those hormones are going to be raging crazy. We try to level those out. Or for a woman who's postmenopause, who maybe, and the medical definition, just to kind of put a label on that, it's medically defined as 12 consecutive months of no period. So it's actually medically defined retrospectively. It's after 12 months of no period. So the longer a woman goes with no estrogen protection, which they pretty much lose when they go through menopause, they lose ovarian function for estrogen. There's still a small amount that they produce, but it's not the E2, the estradiol, which is the most powerful form. So as guys, we make more estrogen than women do, but the end objective is the same thing. We want to mitigate menopausal symptoms, and we also want to provide and restore those long-term benefits to bone, brain, and heart. So to answer your question, generally speaking, we're just trying to replenish those hormones that are now diminished, that are now fluctuating erratically, or they might be totally gone. We replenish them to restore that back to the body, because there's lots of receptors in a woman's body that's very estrogen sensitive. And every month of their reproductive life cycle, these receptors have become very reliant on estrogen and progesterone. And normally it's like clockwork. Every 28 days, the follicular phase, the luteal phase, estrogen goes up in response to FSH. That drops off. The second half of the phase, luteinizing hormone kicks in. Progesterone goes up. Day 21 of the cycle, the body recognizes recognize she's not pregnant, progesterone plummets, the shedding of her uterus happens, that's when she bleeds. Month by month by month, it goes and goes and goes. Once she reaches the end of her reproductive life cycle, ovaries start to misfire, and lots of parts of the brain do not like it, mainly the hypothalamus, which is the body's thermostat. That's what causes the vasomotor symptoms, hot flashes, and night sweats. Long answer to your question, it's about restoring the hormones so a woman can, again, not have to deal with all the symptoms, but also to get that heart, bone, and brain health back.
And again, this may be out of your scope, but is there a right time or a best time for women to consider going on HRT? Because one of the things that it sounded like you said, if I tracked that correctly, is like if we go 11, 12 years past your menopause, you're not a candidate for HRT?
It's not that you're not a candidate because everyone's very specific. It's just saying that is based off of mainly the Women's Health Initiative that studied back in 2002. Anybody at any time could be a candidate for hormone replacement therapies. So if you're outside of that range over the age of 60 and or more than 10 years postmenopausal, doesn't mean that you're excluded from being a candidate for it. It just means that it's going to have to take a much more individualized approach, and every approach is individualized for each individual woman. But once we get outside of those levels, the study, the Women's Health Initiative back in 2002, did find a slight increased risk for some blood clotting things if it was more than 10 years postmenopausal. So it's not that they wouldn't be able to, it's just a matter of having to be much more specific, paying much more attention to blood to make sure that there's no underlying conditions. But to answer your question, the education piece, I think, is what needs to start at a very young age. Call it early 30s, mid 30s. I think the education should start because the prior generations, I believe, menopause is not something that a lot of women want to talk about. It's still now not something that a lot of women are comfortable talking about. I do feel like it's becoming much more mainstream to the point where women are more comfortable talking about these things. But like my mom's generation, my grandmom's generation, like you didn't talk about it. And as women, this is what women do. They just suck it up. They get the job done, right? It's like, I'm going to get it done. I haven't slept in a week. I don't eat very much. I stress. I'm going to go to work. I'm going to get my kids to soccer. I'm going to clean the house. I'm going to take care of the mailman before I take care of myself. I'm going to make sure the FedEx guy's all fed. This is what women do. This is part of what they do. They just get the job done. But it's not fair to women if we deprive them of quality of life, especially when they enter into that phase of their life where they're probably going to spend about half of their life in their postmenopausal years. Let's give them these things. Let's help them to be able to flourish at that time. They should be there mentally. They should be there physically as well. And again, hormones is it's something every woman has to understand.
It's funny you say all of that. I mean, you defined menopause. One of the things I've started asking in our consultations is where are you at? Part of the reason is so I can make a recommendation if, maybe they should talk to you. But what's really alarming is I don't think women know the definition. A lot of women know the definition of perimenopause or menopause. How is that defined? Because I'll ask women and they'll be like, I don't know. Not yet, I don't think,
Right. The best way I do this, Danny, number one, the average age for perimenopause is 43 years old, believe it or not. About 85% of perimenopausal women will exhibit the vasomotor symptoms, specifically hot flashes and night sweats. What I found personally is if a woman is exhibiting those symptoms due to perimenopause, due to hormone fluctuations, they normally know, meaning that if I ask a woman, hey, you're 43, you're 44, you're 45, have you started with any of the vasomotor symptoms yet? Hot flashes, night sweats? Because again, the vast majority of them will exhibit the symptoms. For me personally, if they're like, well, I'm not really, I'm like, stop right there. I'm like, you don't have them. Because if you have them, the minute I ask if you have hot flash and night sweats, like you're probably getting ready to get physical with me, like threaten me. Do you ask me again? I'm gonna get you. It's just they're that frustrated with them. So what I would say is it starts with the age. Again, 43 is average for it. Those symptoms, vasomotor symptoms, hot flash and night sweats, they can last 7, 10 more years. 51 is the average age for menopause, which again, 12 consecutive months. And the other misconception is that the symptoms don't stop once you go through menopause. A woman, now it's hopefully they dissipate, hopefully they're not as severe, but women can exhibit these symptoms well after they're postmenopausal. So the important piece is to, once you hit that age, again, 43-ish, the flag should start going up. There's weight redistribution, Danny, right in the mid region. That's where the weight goes. All the women will tell me I'm doing the same things I've always done. I'm just not getting the same results. And I don't like to discourage women, but if you have a hormone imbalance attributable to perimenopause, menopause, postmenopause, I mean, it's next to impossible to do any exercise or to follow any diet that's going to outrun that hormone imbalance. By all means, I still strongly encourage it, exercise, diet, but without that balance of hormones, I mean, they're gonna find it extremely frustrating when they're not getting the results they want to get.
Awesome. Well, man, this is an excellent episode. I know we got a lot of information out there. I look forward to sharing this with the listeners. If people want to find you, where should they look?
I appreciate that, Danny. Thank you. I'm on social media. It's just under Eric Rittmeyer. My book, The Menopausal Marine. My first one was The Emotional Marine. I'm on Facebook. You can find me all around there. My website, mentaltoughnessspeaker.com. That's my other mental toughness stuff. LifeMedInstitute.com. We're here in Baltimore, in Timonium. We have locations in Columbia, Rehoboth Beach, Delaware. We're in Bel Air in Hartford County, so we're all throughout the state of Maryland. But you Google me, you find me. You also personally, Danny, are more than welcome. And you have my cell phone. You are welcome to give it out to anybody who wants it. My phone is on all the time. Our conversations are very confidential. So anyone that reaches out to me is, we do HIPAA is a very big thing for us, privacy. So we do not repeat anything. You're not judged on anything. We have great conversations, and I welcome any of your listeners who would like to get more information. I'm available 24/7. I can't thank you enough for having me. I really appreciate it.
No, I appreciate you for coming on. Hey, guys, listen, if you got anything out of today's episode, make sure you go ahead and like, subscribe, and share. And listen, if you learned something today, the best thing for you to do is pay it forward and teach it to someone else. Remember, the first step towards the storm should always be your own. Until next time, guys, keep living, head down, horns up, salute.